adolescent young adult cancer survivors are individuals who had cancer earlier in life, but that also includes children, teenagers, and young adults in their 20s and 30s who are now more than 5 years out of their cancer treatment but are still at risk for late effects.
Adolescent and young adult cancer survivors need a special annual checkup in order to screen for chronic conditions that can occur as a result of their treatment. Each therapy is different, but we know that many of the common treatments can lead to long-term health effects. If we're able to screen for those early, we can prevent them from getting worse and treat them if we find them.
There are multiple special concerns for these adolescent young adult cancer survivors that we will focus on in these meetings. They are at risk for not only late effects from treatment that may involve different organ systems such as cardiology, pulmonology, endocrinology, neuropathic effects from treatment, fertility issues.
So one of the particular concerns that adolescent and young adult cancer survivors face are fertility issues. They're now in their prime years for having children, and we want to be sure that they're able to do that as safely as possible based on their risk from their cancer treatment.
One additional concern that these patients have at this age is that they will eventually age out of their parents' insurance and will need to acquire insurance as adults. This can be an additional challenge based on the fact that they already have medical conditions that may make acquiring insurance more difficult. Our social workers are equipped to help them with this.
Typical survivorship checkups are with a multidisciplinary team, so patients see not only an oncologist, but also a nurse navigator, a social worker, a dietitian, a behavioral health consultant.
At an average appointment, we will go through the patient's past medical history, work with the team together, and make sure that we are covering all of the patient's current needs as well as the risk factors that they may have for late effects from treatment.
It is absolutely important that adolescent young adult survivors of cancer have a primary care physician, but we also recommend a visit with a specialized survivorship team in order to specially screen for chronic effects of their oncology treatment. Regardless of their treatment, it's a good idea for adolescent young adult cancer survivors to stay physically active, to avoid smoking, to maintain a healthy weight, and to get regular checkups with their physicians.